University of New Mexico, or University Hospital's Women Health Clinic. They offer specialized care to women throughout their lives. Now, their team of highly skilled providers deliver patient-centered care, focusing on unique needs of women.
And for many women, they overlook the importance of getting a pap smear and how it's so crucial to their health. So joining us now to discuss the importance of women's health is Dr. Brenda Pareda, an assistant professor at Division of Family Planning at the University of New Mexico. Thank you for joining us.
Yeah, doctor, thank you so much. Really important stuff to talk about. So, when should a young woman start thinking, you know, I have a daughter, these are things that I need to know. When should they start thinking about getting a pap smear?
So at age 21 is when we recommend to begin cancer screening.
Okay.
Anytime under age 21, we don't recommend it.
Okay.
Even if their initiation of sex begins. So age 21 is the answer.
Age 21. Okay.
Now, how do you guys care for adolescents?
Okay, so that's a huge question, but to keep it in the context of pap smears, we do recommend the human papillomavirus, the HPV virus vaccine, and that's for boys and for girls. And the age that we tend to start recommending it to parents are around 11, 12.
Okay.
Okay, so for boys and for girls.
Okay.
Okay, so that's one. Number two, remember that we live in a state with incredible high rates of teen pregnancy. So we really do want to talk to our teens about contraception.
Communication is so important.
And so contraceptive counseling is important. And then the third thing is we want to counsel our teens about sexually transmitted diseases. We want to counsel them and we want to screen them. And so that's how we take in preventative health.
Okay, now how often should women get pap smears?
Okay, so that's a great question. So from age 21 to age 29, we want to screen them every 3 years.
Okay.
Okay. Some people think, what about the HPV? That's standalone HPV or concurrent co-testing with a pap smear. We don't recommend it from age 21 to age 29. Okay. So pap smears alone every 3 years.
Okay. Okay.
All right. So probably a lot of people may not know this, and obviously, again, this is something that I want to know as a father of a child as she grows up. When we're talking about fertility and it being affected, if you get something that comes back abnormal in a pap smear, is that something that we need to be worried about? I mean, what's the next step when something comes back abnormal? Okay,
before we go on to that, let me because I told you about age 21 through 29, but we can omit the age 30 to age 65, and that's the majority of the women. So for those women, you can do pap smears every 3 years, but the preferred is pap smears and HPV co-testing, and we can do that up to 5 years. Okay. Okay. And then following up, the next question was, what happens when a woman gets an abnormal pap? Yes. Okay. So there's very complicated algorithms. If a woman gets an abnormal pap, it depends on what kind of abnormality, and that then puts her into one of the algorithms in terms of how to take care of her. But once there's an abnormal pap, we really do need to surveillance the patient, and sometimes they fall out of the every 3 years or every 5 years, and then we need to see them yearly or every 6 months. So it really depends on the abnormality.
Okay.
Okay.
Well, thank you.
All right. Well, thanks for bringing that information in, folks. And if you want more information on what the hospital can do for you, head over to casa.com. We'll have all the links that you need there. Doctor, thanks for coming and sharing this information.
Thank you for having me.
All right.